And this is the medical data mining science. And there are many ways to approach this idea. One of the what seemed to be a very promising attempt was done by Google. Did you hear about Google Health? No? It's funny that you didn't. A very big project with all the powers, the mighty powers of Google, to connect all the hospitals and medical centers in the world and create what is called a personal health records. It's not the electronic medical records. Personal health records means that every patient, every person can can manage his own personal data as opening a Gmail account. So you could just log in, and this is what I did. I logged in with my name, and well, I just invented some diseases and some conditions. I don't have the Christmas disease. And it's like a medical record, an electronic medical record, but from the personal point of view, not from the hospital point of view. And I can put all my blood tests and all my other kind of medical data that I have. And you see, my blood type, my race, everything, and several other conditions, allergies, procedures that I've gone through, immunizations, and so on. And really, you know, the big obstacle I think in this field is IT. Making all the different machineries, computing systems in different hospitals talk with each other. And the idea is that really a big company like Google could do that, could accomplish this challenge. So you can import your medical records from other hospitals, from other clinics, from other institutions, and you have different kinds of tools that allow you to do that. You can see it here. And then you can explore medications and treatments using data mining algorithms that interpret the data you put inside. You can see different kinds of drugs, many times by third parties, not by Google, but from professional medical companies. And then you can find some kind of personalized tools, you know, the big premise of personalized medicine. So there were other third-party applications that try to do some kind of personalized recommendations on what you should do with your health. Everything really looked very nice. You see, there was a abundance of companies that put their algorithms in this, under this or above this platform that solves all the IT problems. And you could also export if you had to give your all this data to a physician that is not connected to this system, so you could export everything. That was really nice, and everybody was sure it will succeed. But it failed, completely failed. No one used it. Really, I think the joke is that there were more programmers in this in this project than patients. So after years, and really when they launched it, Google celebrated it in the biggest way possible. And then they closed, they shut down the project, the whole project. And this is very funny, because there was another company called Patients Like Me. Have you heard about them? Patients Like Me. It's a much smaller company created by two brothers. One of them is this brother, who unfortunately was diagnosed with ALS, and the doctor said, okay, you have 3 years to live, and you are going to be paralyzed and to suffer a lot. And that was really a very sad story for the family. But now his brother, the healthy brother, said that really it was a gift, not of course the disease, but the consequences. So they opened a web portal, very humble one, that anyone can log in and fill the data, the medical data, by his own. So what is the difference from that? What is the difference between that and Google Health? In both cases, you can provide the data. In Google Health, it can be done even automatically. So there were two differences. One difference is that everything here is social. The idea is not that algorithms store the data and interpret the data, but that you can speak with other people who have the same kind of diseases, who take the same kind of drugs, who has gone through similar side effects, and you can talk with them and you can compare the medical record. This is the medical record. Over time, you can fill in the different drugs that you take and the side effects that you experience. And then algorithms can analyze the data. And here you can see the different colors. One means which symptoms do you feel, which drugs you take, which side effects you get. And you can see everything is analyzed and correlated. And this really enabled people who are like the patients. This is why the platform is called Patients Like Me, to meet and to talk and to exchange information and to not only exchange just the information, but the recommendation. I think last year, Rachel, you told us about a patient of your husband, right? Who her husband is a psychiatrist, and he wrote some kind of a drug to that patient, but the patient said, "No, I don't want that drug. I want another drug." Why? Because on the bus, the way here, I sat next to another person who had the same kind of condition, and she said that I must take that drug. So, and we are all familiar with this phenomenon, and now it is done through much more professional ways. And you can print logs of your data. And some of the real data mining tasks that they did here is to look it over time. They call it a time machine. The idea is like, the time machine of Apple. They have this operating system that enables you to see all the versions of a document that you edited, for example. You can go back in time and see the history. So this is what they did. They actually took many patients, and you see here the kinetics over time of different symptom or a different condition, right? And they glued everything together using algorithms, and then they are able to predict if you, for example, if this is your trajectory, if this is your kinetics, what is, and this is the present, what is the prediction for the future is going to be. So, and this really gained a lot of success and was quite amazing. They actually published some papers. One of them, the most famous one, was in PNAS, that provided comparisons between people who took lithium for a certain disease, and it is considered today the biggest or the largest trial. It's not randomized, it's not blinded, of course, but the numbers are so great. So many people use this, so many people provide the information voluntarily that it's a good resource and was proven to be very accurate. And for that, what we need is, of course, algorithms to do all that kind of correlations and analysis.